Good morning, students. We are going to start with chapter 4 of NCERT, that is reproductive health. It is almost the continuation of our previous chapter. As for now, I can expect that you have full grasp over the concepts, diagrams, as well as terminology of chapter 3. So, this chapter is going to be smooth ride for you. First of all, have a look over the logo, which itself explains the agenda of the current discussion. So, let's continue. Topics which are being covered in this tutorial are reproductive health, demography, and contraceptive methods. First of all, you have to understand what reproductive health comprises of. It is been related to all aspects of reproduction in terms of physical, emotional, behavioral, as well as social. In the diagram itself, it starts from the time of conception up to the postnatal care. So it is a very broad concept. Now, in this chapter, we have to cover the problems related to reproductive health and strategies being formulated to curb these problems. The problems are quite basic, related to hygiene. First basic problem is hygiene of reproductive organs, which causes sexually transmitted diseases or infection. And the next problem is early marriages, which is quite prevalent in Indian society, ultimately led to high maternal as well as infant mortality rates. Infant mortality rates or mortality rates describe death rates. Okay, so due to lack of awareness, there are rapid increase into the population size of the India. Next is illiteracy, is the basic cause for myths and misconception related to sex. Next is Indian government have formulated several strategies since after the independence, that is in the year of 1951. Then the basic or concrete step has been taken in 1997, that is reproductive and child health care program. This provide all sort of awareness in terms of print media, audiovisual aids, and going to provide all sort of infrastructure at the local level to care the mother as well as infant one. The awareness has been created with via audiovisual aids and print media. Encouraging sex education at the school level is very important to prevent all sorts of myths and misconception related to sex. Next is full-fledged information about the adolescents, reproductive organs as well as hygiene sexual practices is very important to avoid all sort of STDs or STIs. Next is to provide all sort of infrastructure to care the mother as well as young one. Next is awareness of the problems due to uncontrolled population growth and evils like sex abuse and sex related crimes. Next, there is a statutory ban over the amino sentences. What is amino sentences? It is the practice to take out the amniotic fluid from the mother body to determine the chromosomal abbreviation or chromosomal disease in the young one or the fetus one. So this was the case with the amino sentences, but it has been malpracticed in India to determine the sex of the fetus, which ultimately led to the female feticide. So this practice has been totally banned in India to avoid female feticide. Next is population explosion. When population going to be increased at enormous rate, then it is referred as a population explosion. We are going to compare the demographic pattern in the world as well as in India. First of all, the world population is about 7.8 billion in May 2020. These are the current statistics not being mentioned in the NCRT. Next is the at the time of independence, the population of India was about 350 million, and it has already crossed a billion mark in 2000. The reasons for such a population explosion are the rapid decline in death rate and maternal mortality rate, decline in maternal mortality rate, and decline in infant mortality rate in terms, and then increase in number of people in reproductive age. We have a vast strata which is entering in reproductive age every year. So we have young generation which is reproductively active, ultimately going to produce offspring, and we are in the stage of population explosion. Next is steps to curb population growth. First of all, the government has taken steps to raise marriageable age for girls up to 18 years and boys up to 21 years. Incentives and lucrative offers has been provided for the couples having small families. Then motivation has been provided in all aspect, in terms of society, in terms of governmental aid for the small families, and slogans like hum do hamare do, one child norm has been published in all available social platforms to have the small families. The ultimate aim of these program is to have the small families. Why I'm telling you this? Because in 2019, uh, question has been asked that frame a poster which signifies the population control measure. Okay, so I'm telling you this to give you points for that poster. If similar type of question has been asked in recent years, so you have a clear cut idea what kind of point you have to inculcate in your poster. Next is birth control or contraceptive methods. These are the best method, and based on the motivation and knowledge or awareness. The next thing is properties of ideal contraceptive must be user friendly, easily available, effective, and reversible. What does mean by reversible? If the couple want to have the baby, they can have after the usage of contraceptive methods. So they are reversible. Next is they need not to be interfere with the sexual drive, desire, or sexual intercourse. Next thing is precaution must be taken while using these contraceptive. First of all, consultation has been required for from a qualified medical professionals. Next is they need not to be used regularly, and next thing, they should be used when the couple want to avoid pregnancy or some personal reason. Of course, there are ill effects being associated with the contraceptive. These are nausea, abdominal pain, breakthrough bleeding, along with irregular menstrual bleeding. In severe case, the woman can have breast cancer as well. This is the learning map for the contraceptive methods. There are four contraceptive method categories. These are natural, barrier, chemical, surgical, or sterilization. In natural method, we have three categories: periodic abstinence, withdrawal or coitus interrupts, then lactational ammonia. In barrier, we have condoms, diaphragm, cervical caps, and walls. In chemicals, we have again three subgroups. These are IUDs, oral, injectables, along with some sort of implants and emergency contraceptive methods. Next is not in IUDs. What are IUDs? These are non-medicated, copper releasing, hormone releasing. Oral are of pills type. They can be taken in the form of tablets. Okay, so these are steroidal, non-steroidal, POP and COP. What is POP? That is progesterone oral pill. Next is COC is progesterone, estrogen combined pill. So the full form is of the COP is combined oral contraceptive. Next is the subcategory of surgical sterilization. You have already studied in class 10th. These are vasectomy and tubectomy. This is the basic framework for the natural contraception. Here you can see this do not require any sort of medicines or devices. The principle behind is to prevent the chances of ovum and sperm meeting. Next is methods are periodic abstinence, withdrawal or coitus interrupts, and lactational ammonia. Lactational ammonia is very, very important. It has been asked in several board examination. Periodic abstinence, it refers to the abstain or from the coitus during the time of ovulation. As you know, at the 14th day in the menstrual cycle, the ovulation occur, but it can vary from person to person. So the protected period, that is 10 to 17 days, has been framed out for the periodic abstinence. So full-fledged knowledge about the menstrual cycle is being required in this case. Next is avoid insemination. This is the normal practiced method, natural method. It basically refers to avoid insemination when at the time of ejaculation the sperms are going to be released inside the vagina. At that particular time, the penis going to be withdrawn from the vagina. Next is lactational ammonia. Here you can see ovulation and menstrual cycle do not occur when the female is going to have intense lactation. Mind my word, intense lactation. Only then this method is going to be worked out. Otherwise, there is no chances of the contraception. The best thing is that these methods do not have any sort of side effects, and the chances of failure are quite high because it requires a clear cut knowledge about the menstrual cycle, about the time of insemination, as well as the lactational, intense lactational period. Okay. Next is barrier method. Barrier method is quite prevalent in Indian society, and there are various type of barrier methods. First of all, condom made up of thin rubber latex sheet, you can see, and can be used by male and female. The first indigenous male condom was the Nirod, being made by the government of India. You're going to cover the penis, and female condom is going to cover the cervix as well as vagina. And the principle behind is to prevent the physical meeting of ovum and sperm for the fertilization. The benefits are quite enormous. You can see uh, they can be used just before that of the coitus and going to protect the user from the STIs and AIDS. They are disposable. Next is diaphragms and cervical caps are going to be made up of rubber and used to cover the cervix. It ultimately blocks the entry of the sperms through cervix. They are reusable. However, condoms are non-reusable. They are one time for the one-time use only. And diaphragm and cervical caps going to provide the privacy to the user. Next is spermicidal gels, creams, jellies. The chemical formulation, the basic chemical formulation is a non-oxynol 9. They are going to be applied with the help of applicator and going to be inserted inside that of the vagina, blocks the entry of the cervix. The basic thing associated with these creams, jellies, and foams is that they are going to provide additional contraceptive utility with condoms and diaphragm cervical caps. So they are being used along with these above methods, not as a separate one. You can see the pictorial view of the barrier contraceptive, male condom, female condom, diaphragm, cervical cap, wall cap, and these are the foam, gels, jellies, and creams. Asha Nirod is first of the indigenous condom being manufactured by Government of India. This is free, readily available at free of cost at healthcare sectors. Next is chemical contraceptive. We have already discussed the layout of the chemical contraceptive. These are basically of five types: IUDs, oral, injectables, implants, and emergency. Some of the books, oral and emergency pills has been combined together, but these are the separate categories I have demarcated over here. So you should have clear cut understanding the basic. There are basic five categories, IUDs can be non-medicated copper releasing and hormone releasing, and pills can be steroidal, non-steroidal, progesterone, and pop and cock. We have already discussed the full form, and later also I will tell you. First of all, we are going to discuss about non-medicated inert IUDs. Lips loop. Lips loop has been named after the inventor, that is Jack Lips. I have mentioned over here, and they are made up of polythene, steel. So various varieties of lips loops are being available. They have phagocytic, that is, they are more like going to engulf the sperms. The basic tendency of the lips loop is to phagocytosis of the sperm inside that of the uterus. Next is copper releasing IUDs. Copper 7, copper T, multilode 375. These are the basic categories of the copper releasing IUDs, and they are going to release copper ion, which ultimately curb the motility of the sperm and fertilizing capacity of the sperm. Next is hormone releasing IUDs. These are progestastat, LNG20. The full form of LNG is levonorgestrel, that is linorgestrel. Okay, so you have to learn this term, linorgestrel 20, and it make the uterus unsuitable for the implantation and the cervix hostile for the sperm. The basic advantage being associated with the IUDs is that they are easily available at the healthcare centers, widely used, and they are going to avoid pregnancy and space out the children for the family planning. Now you can have the look of the other intrauterine devices: lips loops, copper 7, copper T, multilode 375, LNG20. You can see the size, and progestastat. And next thing is oral contraceptive. As the word suggests, they are being available in the form of tablets, pills. Okay. So first category we are going to talk about the steroidal. As you know, progesterone and estrogen are the steroidal hormones. So they are being made over the combination of these two hormones. POP is progesterogen's only pills, and the unwanted 21 days Yasmin has been available in the market, and this tablet has been taken once after 21 days. Next is the mode of action. They are going to make the uterus to be hostile and going to thicken the mucus, going to form the plug itself, which ultimately stop the entry of the sperm inside the uterus. Next is estrogen progesterone combination pill. These are combined oral pill because they have both the combination of steroidal hormone, so they are referred as combined oral contraceptive. The available forms are the Mala D and Mala N, being advertised by the government of India. And next thing is how they are going to be taken. They should be taken daily for the 21 days, and starting preferably within the first 5 days of the menstrual cycle, and then the gap of 7 days has been taken to avoid pregnancy. So they need to be taken for the time gap. Okay, it has to be repeated in the same pattern till the female desire to prevent the contraception. Next, it's going to inhibit the ovulation, prevent implantation, and alter the quality of the cervical mucus to prevent and retard the entry of the sperm. The main advantages that is used by the female only, not by the male. Okay, they are very effective, have less side effect, as we have discussed in a various method. They have lots of side effect, but here the side effects are quite nil and well accepted by the females, especially in the villages. Next is non-steroidal pill, that is anti-estrogen pill. They are referred as mini pill or centocomen. The best pill available in the market of this combination is the Saheli, and they should be taken once a week. So there is no counting of the days about the menstrual cycle. Only this need to be taken once in a week. Okay, prevent implantation, and uterus lining going to be thin with the usage of these pills, and have very few side effects, having high contraceptive values. So this Saheli pill is basically used by most of the women belonging to village area or metropolitan area. Next is injectable contraceptive methods. These are being available in the form of tube-like structure. The size is about of matchstick. The injections in terms of progesterone or progestogen estrogen formulation are going to be provided periodically to prevent any sort of pregnancy or implantation. They are going to block allet surge and therefore prevent all sort of ovulation. Thicken cervical mucus, alters the endometrium receptivity for the implantation, going to thin down the endometrial wall. Next is separation of the FSH is not going to be too much intense, and follicular growth is not appropriate, so that the follicular development cannot be up to that pace as a normal one. Next is advantages, very effective, long acting, and reversible. They can be reversible if the couple want to have the baby, they can have, and easily to maintain the privacy of the user. Not a coitus related matter, no daily pill taking requirement. So this is going to avoid any sort of regularity in taking the pill. Next is several disadvantages being associated with the injectable contraceptive method. First of all, irregular bleeding or menstrual flow. Next is return of fertility may take up to 9 months after using these type of hormonal implants. The fertility of the woman have to wait up to that of the 9 months. Required another injection every 1 to 3 months. Next is it is totally going to uh, have sexually transmitted disease in terms of infections like HIV, AIDS. So this is not going to provide any sort of safety to the user in terms of STDs or STIs. You can see it is being inserted in the arm of the female, and the size is about of matchstick. Why they are referred as implantable? The term has been derived from the implanon, which was previously or the older version of the implants, and the recent version is nexplanon. This is going to stop the pregnancy. Next is emergency contraceptive pill. First of all, the side effects are quite enormous in case of emergency contraceptive pills. They need to be used within 72 hours of the coitus. They have the combination of steroidal hormones like progesterone plus estrogen, and copper IUDs. Going to stop all sort of ovulation, thickens the lining of the endometrium, and going to retard the motility of the sperm and block the cervical area, ultimately going to bring about the changes in the composition of the sperm as well as egg, so there are no chances of the fertilization. Need to be avoid pregnancy due to unprotected intercourse or in case of rape. Next is why it should be avoided, because various side effects are being associated, as I have told you before. It causes nausea, mood swings, heartburn, and vomiting. It can disturb menstrual cycle. Repeated use can lead to difficulties in conception later on, because repeated use is going to alter the hormonal balance of the body. So, bringing back the fertility is uh, very difficult when the person is going to use these emergency contraceptive pill again and again. It does not protect against STD. This is very very important. Going to have hormonal imbalances, and they are more like a shock to the body. Next is surgical sterilization or contraceptive method. This is very very important. This is going to have the terminal or permanent method for the termination of the pregnancy. Vasectomy, as you know, it is done in the male, and tubectomy done in the female. And vasectomy, the vas deferens has been cut out and seized. A small incision on the scrotum, a part of the vas deferens is going to be removed, because all of the incision has been taken from the vas deferens is tied up at both cut it and cut it and next is incision stitches. As I have told you, they need to be stitched up. Next is fallopian tube, a small incision in the abdomen or through vagina. A small part of the fallopian tube is going to be removed. Fallopian tube is going to be tied at both the ends again and stitch the incision made. First of all, it's going to block the gamete transport and thereby prevent all sort of fertility chances. Next is highly effective, and reversibility is very very poor. If the person wants to uh, uh, reverse the act or want to have the baby, the chances are very less. These are the diagnostic view for vasectomy and tubectomy. That's all for this presentation. Thank you, students.